here, then what's this muscle that comes around to the front? Like this. Yeah, right? That's the one that's going to keep the scapula from winging out like that. So it's pulling. All it's doing is attaching onto this front edge right here. Okay? The subscapularis takes up this whole fossa right here. All it leaves for anything else is just this edge right here. So it's attaching like this. So it's going to pull it forward like that. And that's why it's the muscle that works when you're doing the push-up with the boxer punching muscle.
Do you take that jug home with you at night?
What's that?
Do you take that jug home with you?
Well, this is the first time I brought it. I just made it within the last couple of days. I've logged a lot of miles driving skeletons around to different events and stuff, and it doesn't fly. I'll put it this way: I'm not going to risk the $300 to try to see if it'll fly or not. Oh, really? No, I'm not going to. So, like basically the rotator cuff, what those muscles are doing is they're holding the humerus in against the glenoid fossa. And the other thing is when you're doing for rotator cuff problems, if somebody has rotator cuff tendonitis, and when you talk about in orthopedics, something starts out as a tendonitis, you get wear and tear on those tendon fibers, and eventually you can start getting frayed and inflamed and things like that. But in the early stage, if you're working on it, you're doing like cross friction massage, okay, because the fibers run this way, so you're going to go across. And to get more access to the supraspinatus tendon, what can you do to get more access out of it, or to get more access to the tendon? Is that if you so if this is the supraspinatus tendon here, my arm's up like this, which one's going to have, I'm going to show more of the tendon like this, or if I'm out like that? Yeah, when you put the arm across like that, you have access to more of the tendon right there. And then you can get in and do like the cross-section massage. So what we do is like, you have a patient bring their arm up like that, and then you're going to get more of that supraspinatus tendon. So you can go across more like that. So you go underneath the acromion, you're on the humeral head, and then you're getting more of that supraspinatus tendon, whereas up here it's pulling itself back up underneath the acromion here. Whereas with the the infraspinatus and the teres minor, there's nothing, it's not going underneath anything. They're pretty much right there. You can access it. In the subscapularis, you might get more of it if you pull out like this, if you externally rotate like that. So then here showing you have the subscapularis. I mean, basically you're palpating, what muscle is most superficial right here? As you get over the humeral head, what muscle sits over it like this? Deltoid. So you're really kind of going through the deltoid to get to the subscapularis, unless maybe you came around under here, but then you're starting to look at the edge of the pec. So then here you have the two different rhomboids, and one's going to go to at the base of the spine of the scapula for the minor, and then the major is down from the root of the spine of the scapula to the inferior angle of the scapula. And since they run in this direction like this, they're going to bring the scapula up. But then they're also going, if they're pulling this way, they're going to downwardly rotate it. As they're pulling here, they're going to go up like that, which is downward rotation. But they're also going to adduct the scapula, which is another way that we can say adduct for the scapula. Retract. Protraction and retraction is the same a lot of times as abduction and adduction. And so then that's the way that you test the rhomboid, is you're bringing this back here, and then you're trying to push back that way, and you're pulling back. And then the levator scapula is going to be up here. If you have the rhomboid attached to here and the inferior rhomboid here, then the levator scapula is here. And it's pulling it up like that. And so that shows the levator scapula underneath the trapezius. And again, it's going through the transverse process of the cervical vertebra. And then there's the serratus anterior. So like I was saying, if you're sometimes when you're doing muscle work on people or something, you're coming in like this, and if you're coming in here, on one side of your hand is the serratus anterior, and then on the other side of your hand is the subscapularis. Okay, so if you're going in here, you're working this side is the serratus, and then on the other surface of the scapula is the subscapularis. So that's it, like I was saying right there. So if you're doing muscle work and you're going in deep in there, you're working the different muscles. And then here's where you can see there's a muscle testing for the serratus anterior. The person's trying to push up like that, and you're pressing back, you're pressing up like that.
If someone did have like some sort of tear in there and you're going in there and you're massaging it, could that potentially make it worse?
Not. I mean, if it's an acute tear, then you might provoke inflammation if it just happened. But if it's more subacute where it's resolved, you're probably not going to make it worse. Like you're not going to tear it anymore.
Yeah.
But typically, that's the kind of thing you want to do for a muscle strain. But after the acute phase has resided, you're going to go in there and break up scar tissue and do deep tissue friction massage,
so
things like that.
Would the tear be muscular or would it be tendon?
There's not that much tendon there.
So it's mostly muscular. If somebody's torn something in there, it's usually
I
muscular.
think this would probably be one of those situations where it's a direct attachment, because it wouldn't really need to be much tendon.
Really?
And then you can see how they're doing on this here, where they're coming around from the backside, and they're getting the serratus anterior this way, but you're going through the rhomboids. And then they're showing the pec, where you have the clavicular part here and the sternal part, and then you can see how it's twisting like that as it inserts. Same thing like the lentissimus, the fibers kind of cross around. And so then when you do this, you're untwisting it, because it's like this, and then you're going in here and you're untwisting it where the fibers are. Okay, so then that's kind of showing like what I was doing, where if you're going this way, you're testing more of the clavicular portion, and then this way is more of the sternal. And then there's pec major or pec minor. And then when you talk about thoracic outlet syndrome, that could be an issue where it's compressing those veins, artery, and nerves when it comes up. And the subclavius, so biceps, brachii. So there, that shows the long head here. And then there's the short head to the thoracoid process. And then the triceps. So then that shows the long head here that's going from the, what is it attached to? Or what's the origin? The long head's from the supraglenoid, the long head of the biceps is supraglenoid tubercle, then the long head of the triceps is what? The inferior tubercle. And then crocobranchialis. And that's about it. Okay, so does everybody know what's on the schedule for next week?